as appropriate for each situation. When the pump is primed and the grafts are ready for placement, the heart-lung machine is turned on. The heart is cooled, and the aorta is able to be clamped. Blood flow through the heart and motion of the heart stops. The surgeon then stitches the intended grafts into place. Depending on the number of blockages, connections to one or both internal thoracic arteries may be used to complete the necessary bypasses. The clamp is removed from the aorta. Once the heart is beating normally, the heart-lung machine is disconnected, and the tubing sites are repaired. The pericardium is positioned back over the heart. Flexible drains are placed, and the sternum is closed and supported with wire or small plates and screws. The remaining tissue layers are brought together, the skin is closed, and a dressing is placed. After a cardiac bypass graft surgery, you will stay in an intensive care unit, ICU. You may have a breathing mask or tube in your throat until you are awake and strong enough to breathe on your own. When you first wake up, you will have some confusion. This typically improves in a few hours, but may take longer, especially for elderly patients. You can expect to have some pain, muscle aches, bruising, and swelling. Pain medication will help. Other approaches to providing comfort and pain relief will also be used. You will be transferred out of ICU when you are breathing without assistance, and your heart rate and other vital signs are stable. As your hospital recovery continues, the focus will change to assisting you with increasing your activity, even walking. Early
Hello and welcome. My name's John. You probably have a lot of questions about your procedure and what happens now. I understand because I have a stent too. I remember asking, how will my life be different now that I have a stent? What is a stent anyway? Why do I need one? What happens next? In this video, I'll be your guide to some answers. We'll go through things chapter by chapter. So if at any time you'd like to repeat a chapter, just select the chapter you're interested in and the chapter will play again. Let's get started. The workings of the heart are a marvel. It is about the size of your fist and sits just to the left of the middle of your chest. The heart's job of providing the steady flow of blood to the head and body is vital. Blood delivers oxygen and nutrients and removes toxins and carbon dioxide to keep your body healthy. The heart cannot do this job alone. The heart needs oxygen and nutrients to do its job. Coronary arteries supply the heart muscle with oxygen-rich blood necessary to keep the heart healthy and strong. The coronary arteries are like pipes. They supply blood to the heart muscle. Like a pipe, coronary arteries can get clogged over time with debris. The debris that can clog an artery is called plaque. Plaque is a sticky substance made up of cholesterol, fatty deposits, calcium, and other materials in the body. The plaque buildup may break open, what doctors call rupture, and a blood clot then forms over the rupture site. When that happens, the blood clot can partially or completely block the coronary artery. As a result of this blockage, less blood flows through to the heart muscle, starving the heart of the oxygen and nutrients it needs. As you'll see in the next chapter, this causes the chest pain or other symptoms that you may have experienced. Like the rest of your body, the heart needs blood flowing through it to stay healthy. When the heart is deprived of blood, because of a plaque rupture and blood clotting in the coronary artery, the result is a condition doctors call acute coronary syndrome, or ACS. You probably experienced some of the symptoms of ACS. Severe chest pain or chest pressure are common. There are several types of acute coronary syndrome. One type is called unstable angina, which is a condition where a patient feels unexpected chest pain when resting. Unstable angina can progress to another type of ACS called a heart attack. During a heart attack, also known as myocardial infarction, part of the heart muscle dies because of lack of blood reaching it. Acute coronary syndrome is a life-threatening condition that requires urgent or emergency treatment. If a doctor suspects ACS, he or she will perform several tests to find out how the heart has been affected. A blood test will be done to see if heart damage has occurred. Another test, called an electrocardiogram, will be performed to measure the heart's electrical activity. A doctor is also likely to perform a test called an angiogram. This test examines the inside of your heart's blood vessels.
अस्सलाम वालेकुम अयान अली आई एम फाइन थैंक यू आप कैसे हैं
To determine where arteries are narrowed or blocked. In your case, you had a sudden, complete or partial heart artery blockage resulting from a blood clot which caused an acute coronary syndrome. Your doctor can answer your questions about which specific type of ACS you had, how it has affected your heart, and what tests were necessary. When tests confirm that an acute coronary syndrome has taken place, one option is to reopen the artery to help get the blood flowing more freely to the heart muscle again. To do this, doctors perform a procedure called a percutaneous coronary intervention, or PCI for short. It is also known as angioplasty. Let's take a look to see how doctors do this. When performing a PCI, the doctor inserts a thin, flexible guide wire into the narrow or blocked part of the coronary artery. Then the doctor pushes a long, thin tube called the balloon catheter over the guide wire to the area of blockage. When the balloon reaches the blockage, the doctor inflates the balloon, which pushes the plaque against the artery wall, reopening the artery and restoring blood flow. In most instances, the doctor will permanently place a tiny wire mesh made of stainless steel or other metal alloys. This tiny wire mesh is called a stent, and it acts like a scaffold to hold open the inside of the coronary artery. Your stent is made of tiny wires or struts. Each tiny strut can be about the same thickness as a human hair. These tiny struts create a wire mesh tube that helps to support the artery wall, like a scaffold in a tunnel. To do its job, the stent needed to be guided through the artery to the exact place where the blockage took place. The doctor performed a percutaneous coronary intervention, or PCI, to do this. The stent comes mounted on a tiny deflated balloon at the tip of the catheter. During the procedure, the doctor passed the small stent catheter down the artery. Once the stent reached the place where the artery was blocked, the doctor inflated the small balloon. As the balloon inflated, the stent expanded and was permanently locked into place, helping to keep the artery open. As you can see, the stent has a very important job to do, but there are important things you must do after the stent is in place to keep your blood flowing freely to your heart. Let's take a look at what they are. With your stent in place, blood can flow more freely to the heart again, nourishing it with oxygen and nutrients. But for people with acute coronary syndrome treated with the stent, there is a risk that the blood flow can be blocked again. One reason why is found in the blood itself. Inside the blood are lots of tiny, disc-shaped fragments called platelets. These platelets are naturally sticky and easily clumped together to help form clots. Most of the time, the blood clots that platelets form are helpful. Blood clots help prevent blood loss from a cut or wound, for example. Blood clots can also help prevent germs from entering the body at the site of an injury. But for people with stents, blood clots can also be dangerous. After the stent is placed inside the artery, there's a chance that the sticky platelets can get caught on the wire mesh and bind together to form blood clots. If this happens, the blood clot may grow too big and stop blood from flowing to your heart. This can lead to heart attack or even death. That's why it's very important to follow your doctor's instructions after the stent is placed. To help prevent the blood from clotting in the stent or coronary arteries, your doctor may prescribe certain medications. These medications help to keep the platelets from sticking together and forming blood clots, and are designed to help the blood to flow more smoothly through the stent. Doctors call this type of treatment antiplatelet therapy. Your doctor likely prescribed an antiplatelet medicine to be taken along with aspirin. Aspirin is also an antiplatelet medicine, but it works differently than your prescription medicine. If your doctor prescribed antiplatelet therapy, it's important to follow your doctor's instructions exactly. If you do not take your medication or stop too soon, you are at higher risk of a blood clot in the stent, having a heart attack, or dying. Your doctor will decide how long your antiplatelet therapy will last. Do not stop taking your antiplatelet medicine without first talking to the doctor who prescribed it for you. One risk for all antiplatelet medicines is the increased risk for bleeding. But bleeding is not the only side effect of these medicines. Other risks exist too. Talk to your healthcare provider. As a stent owner, it's important to take the medication your healthcare team prescribes and to also follow a heart-healthy lifestyle. You've probably heard of some of these lifestyle tips before, but even though they are good tips for everyone to follow, they are especially important for people with stents because they can help reduce the risk of another heart event. Let's take a look at some of the most helpful. Avoid smoking. Smoking can promote the narrowing of your arteries, which reduces blood flow to your heart. Stay active. Exercise helps to strengthen your heart muscles and keeps blood flowing through your arteries. Talk with your doctor about how much exercise and what kind is right for you. Together, you'll be able to work out a plan that you can follow. Monitor your cholesterol and blood pressure regularly. Maintain a healthy weight. Too much weight can lead to high cholesterol, high blood pressure, and diabetes, which are risk factors for your heart's health. Oh, and there's another benefit to staying with a healthy lifestyle. It's a good feeling to know that you are in charge and can take an active role in reducing the risk to your heart. Now that you know the importance of taking care of your stent and maintaining your heart's health, it's good to remember that living a healthy life is a lifelong journey. As you leave here today, you're one of millions of people with a stent who have made the commitment to making healthy life choices. You're not alone, and your doctor is always ready to answer any questions you may have. As someone with a stent, best wishes to you and a lifetime of good heart health.
Whenever I was doing any physical work, I would have a shortness of breath and at times a tightness in the chest area.
I really didn't have a lot of symptomology until we were down here at the cottage one day, and I was walking up the hill from the garage to the cottage, and I had heaviness in my chest, and I got quite short of breath.
Like these people, you've been referred to the New Brunswick Heart Center, located here at the St. John Regional Hospital, for a coronary angiogram. This is a special test that allows us to obtain important information about your heart.
Your doctor has recommended that you undergo a cardiac catheterization or peripheral angiogram. This video will give you information to help you understand the procedure and hopefully decrease your anxiety related to the procedure. A cardiac catheterization is an invasive procedure which will give your doctor detailed information about your coronary arteries. These are the vessels that provide blood flow to the heart muscle. A cardiac catheterization gives information about the heart valves, pressures in the chambers of the heart, and how the left ventricle functions. The peripheral angiogram is an invasive procedure which will give your doctor information regarding peripheral vessels. These are any of the blood vessels that are located outside of the heart. Prior to your procedure, your doctor will want to gather information regarding your health history. You may have this done in your doctor's office, or you may be asked to come to the hospital for pre-admission testing. For your pre-admission testing appointment, you will be asked to come to the second floor of the hospital to the Cardiovascular Center. After completing some brief history health forms, you will meet with one of the cardiovascular nurse practitioners. A health history will be obtained, and if a physical assessment has not been performed in the past month, it will be done at this time. It is important to bring a complete medication list with you and to notify the nurse practitioner of any allergies to medication, iodine, seafood, latex, or X-ray contrast dye. Your pre-admission testing may also include routine blood tests, an EKG of your heart, and a chest X-ray. Your doctor will determine what tests you will need. The day prior to your scheduled test, you will receive a call from the interventional lab staff between 4 and 6 p.m. to inform you of the time you should report to the hospital. Please do not eat or drink anything after midnight the night prior to your appointment. You will be told which medications you should take the morning of your procedure. Please shower or bathe thoroughly before arriving to the hospital and pack necessary belongings if you are asked to spend the night. Bring any personal items you may need. You may also want to bring a book or magazine. Expect to spend 4 to 6 hours at the hospital for the procedure. If you have had a stent placed, you will spend the night in the hospital for observation. For safety, you will not be allowed to drive for 48 hours after the procedure. Please make arrangements for a ride and to have a responsible person stay with you at home the night after the procedure. The morning of your procedure, come directly to the Cardiovascular Center at your scheduled time. There will be room for your family members to wait during the procedure. There is a television and Wi-Fi available if needed. The staff in the Cardiovascular Center will be there to give your family information and to update them as the procedures progress. The doctors will also speak with family members in the Cardiovascular Center following the procedure. One of the members of the interventional lab staff will accompany you from the Cardiovascular Center to your interventional lab. You will be asked to change into a patient gown wearing only your socks. Bags and lockers will be available to store your personal items, but please do not bring any valuables with you. The nurse in the lab will weigh you, check your vital signs, and perform a physical assessment. You will be placed on a heart monitor, and an intravenous line will be started in your arm. This intravenous line will be used to give you IV fluid and medications. The nurse will review the information from pre-admission testing and ask you additional questions if needed. The nurses will assess the possible sites for the procedure. It could be performed through the radial artery in the wrist or the femoral artery in the groin. This decision is made by your doctor. Both possible sites for catheterization will be prepped. Many times, a light sedative oral medication is given to help you relax prior to the procedure. This entire process will take approximately 1 hour. You will be transported into the catheterization lab by the nurses and technologists that will be caring for you during the procedure. The procedure room is cool in temperature, so you'll be given warm blankets for your comfort. From the stretcher, you will be asked to move to the procedure table, or you will be assisted to the table if needed. The table is fairly hard and narrow. The circulating nurse during your procedure will be there to assist you with any needs you may have. The nurse will administer any medications the doctor orders for you during the procedure. It is common to receive intravenous sedation after the doctor arrives in the procedure room. You will be positioned for the procedure, and the procedure access site will be cleaned with an antibacterial solution. Sterile drapes will be placed over your body. The staff will be dressed in sterile gowns, gloves, and masks to prevent you from infection. At the beginning of the procedure, the doctor will inject a local anesthetic to numb the area where the catheter will be inserted into your artery. This will feel like a pinch or sting. After the local anesthetic takes effect, you will only feel pressure at the access area. If you do feel any pain, let the staff know immediately. Next, the doctor will insert a needle into your blood vessel, followed by a guide wire. A short hollow tube will be placed into your artery over this wire, which is then removed. This is called the sheath. The doctor will guide the catheter through this sheath to visualize the coronary arteries of the heart or any peripheral arteries, such as your legs. When the catheter is at the opening of the artery, the doctors would like to view contrast dyes injected into the artery, and an X-ray picture is taken. Many times a warm flushing or tingling sensation may be felt when the dye is injected. You may be asked to take a deep breath or turn your head from side to side in order to get the camera closer to you. Your doctor and the interventional lab staff will be there to inform and support you during the procedure. During the procedure, multiple catheters are used to view different arteries. When all the information is obtained, the doctor will decide on your plan of care. If an intervention is needed, the doctor will briefly explain this to you and then proceed with the angioplasty or stent placement.